In this week's Cardiology Countdown, we begin with HDL, a hot topic that we've always thought has been good for you and named it thus the good cholesterol. A new study in over 100,000 patients has looked at genetic differences and polymorphisms that lead to different levels of HDL as a way to do what's often called a Mendelian randomization. So in the large cohort of MI patients and controls, they found that HDL was associated with MI risk when looking across the population, lower HDL, higher risk. But when looking with genetic polymorphisms, those who had higher HDL did not appear to have a lower risk of MI. And so it calls into question a little bit the association of HDL and MI as to whether it's related to the HDL levels or other factors that patients have that give them low HDL, like obesity and insulin resistance, etc. All the same, it's noted that there's a lot of research in this field with drugs that can have very large increases in HDL, and so we await those as really the final story on whether raising HDL could be helpful. At the number 2 spot is a pair of studies in JAMA that look at sleep apnea and CPAP. One is a cohort study that finds that sleep apnea is associated with an increased risk of developing hypertension, and that patients who were treated with CPAP in an observational sense had lower risk of hypertension. On the other hand, a randomized study that was done at 14 hospitals, about 700 patients, failed to show a reduction in hypertension cases developing over time in those randomized to receiving CPAP versus conventional therapy. And it had somewhat limited power. There was about a 15% lower risk of MI, just not statistically significant. And so it appears there may be an effect, but not yet proven. And at this week's number 1 spot is a fascinating study done looking at the use of aspirin to prevent recurrent venous thromboembolism. So this was an investigator-initiated study in patients who had developed unprovoked venous thromboembolism, either DVT or PE, and completed a 6 to 18-month course of warfarin that the treating physician determined. And following that, were randomized to aspirin or placebo. And they found a significant reduction in recurrent events with a hazard ratio of 0.58. It was a modest-sized study of just about 400 patients, but they did see a benefit of aspirin when used following the warfarin therapy. There wasn't a difference in major bleeding, and so this could be a major new change in how we follow up initial anticoagulant therapy for venous thromboembolism. So for this week's Cardiology Countdown, I'm Chris Cannon.